We would like to welcome back Dr. Abdulhameed Alwabari to explain for us the different approach to improve image quality.
صباح الخير. Today I will speak about how to improve image quality. I cannot stand here. So, what do you think? I can, with one parameter, I can improve an exam. Still, can you hear me? Oh, okay. It's working. So, yeah, by one parameter, I can improve image quality in MRI. Do you have an idea what it could be? ما في شغال؟ maybe. Yeah. What it could be? Sorry? I cannot hear you. Okay. However, it's the patient position. Okay? And I will speak about breast MRI, and we will see how the position really affects the exam. What is it? Okay. The most common reason for American College of Radiology mammography accreditation failure is inadequate positioning. Failure of the exam. It's not artifact. Failure of the exam. Excellent positioning is key in breast MRI imaging, just as it is in mammography. Key for excellent exam. Distortion of the breast can result in signal hotspot, poor image quality in the region of the chest wall and axilla, an anatomical distortion that make image interpretation difficult. So it's only position, and it's the least of our care. Okay, actually the whole of this lecture from an article, and the author was saying that if you want to produce good breast MRI, you need to have contrast and use of high strength magnet, 3 Tesla. Okay, can use this one. Use of dedicated coil. By the way, this is amazing, dedicated coil. You know what? I have worked locum in a hospital, and the coil wasn't a coil. It was fallina. And the coil we are using for shoulder, the loop coil in Philips, you just put it there. So it's not really a coil. We need high spatial resolution protocol. We need appropriate timing, and this is important. Usually I go fast on this points, except this one. We need to have standardized timing. What does that mean? Usually, I start injection and the scan starts after 20 seconds for all. Not I'm using 20 seconds, you are using 15, the other using 25. That's standard. The radiologist will know that the time of enhancement is the same. If there is any delay of the enhancement, it's because of the pathology. It's not because of the tech who inject late, who start late, who. So let us remove, this discrepancy in our practice. Artifact-free image, and that is your skills. And the last one, from criteria, is positioning. So they address it as one of the criteria for good exam. Improper positioning lead to unhomogeneous fat sat. All the organs we are imaging, the majority is hydrogen atom in water, except breast. The hydrogen atom comes from fat. So I need good fat suppression to show the lesion or the pathology. Improper position also lead to artifact. And this is not from me. I was thinking to change it to say missing findings, but they wrote missing cancer. It's from the article. So yeah, maybe it looks weird, but this is a fact. And documented that poor positioning might lead to missing cancer. And we will see some images in the coming slides. Do you agree with me first? I don't know. Okay. Why position is important? Good positioning is important because I need to image maximum tissue. So when we do breast, we are doing from here up to here. We are including the axilla. It's not the breast itself, right? So we need the maximum tissue. We need to minimize the fold. The fold is the enemy in a breast MRI because it disturbs the fat sac. And there is a technique, we'll show it in next slide, how to avoid the folds. Achieve homogeneous fat sac and provide non-deformed breast parenchyma and provide homogeneous contrast flow through the whole breast tissue. It's supposed nothing to hinder the flow of contrast between tissues, and we will see what caused that. Why breast position is difficult? Because, it's prone, and everyone, even in his normal sleep, he doesn't like to lay down over his abdomen. So patient might be reluctant to lay down in prone position. The second is that it's external, non-fixed, variable size organ. So, the position is every time is different from one patient to another. It's not just lying down. You have to move the patient up, to the right, down a little bit until you reach to the optimal positioning. Difficulties, and what's the difficulties we might encounter in breast MRI? High percentage of fat. So what does that mean? We need very efficient fat sac, not partially suppressed. You know how many times I repeated fat sac? It's essential. Even whenever you read any article about breast MRI, you will encounter this. Variability of breast size. Yeah, that, you need to adjust, from one to another, from one patient to another. And that will lead us to what also? Just to mention this, different protocol. Where I used to work, we have 3 protocols. We have a protocol for small breast, we have protocol for normal breast, and we have protocol for large breast. Why is that? The protocol is set because we don't want anyone to come and change. From small, then increase the field of view, increase the matrix, adjust the slice thickness. It is set for you. Because too many changes in the practice will lead to an error. So we made it ready. And even if you have a new tech just join the team, okay, and he start to do this exam, he will not change from one to another. He needs just to have it and apply it. So we have this technique. And we have presence of fat air interference from the side, like air, tissue, air. And you know that whenever we have, as Dr. Abdullah said yesterday, whenever you have air and tissue, you have difference in hydrogen atoms. The air has no hydrogen atoms, a few, unlike the tissue. So that will cause difficulties too. Okay, what are needed for proper positioning? First, female technologist or nurse. Certainly, even in Europe, there is no male positioning breast. But what does it mean by having a female technologist? We are different from you. Here, most of the technologists are females. There, in Saudi Arabia, we have few. Yeah, that's why yesterday I was wondering. So we don't have, where I work, we were 3 males. So we asked for a female, for a nurse to come with us. And we trained her. That's what I mean by female. When you have a nurse, do not just ask her position. No, go with her step by step. Show her the proper positioning. Especially the Filipino and Indian nurses grabbed it fast. I need to go back. Yeah. And the second one is to review prior scan. If there is mammo, just read it. Just see what the doctor said about it if it is the first time. If it is follow-up, just have a look to the old scan. While the female tech or while the nurse is positioning the patient, now everything in the computer, just go and check her previous imaging history. And dedicated coil. This is the one I was explaining. هذا فلينة. Seriously فلينة. And I'm surprised. And then they bring this one. If you work in Philips, they brought this coils, which we use it for shoulder sometimes, and they put it. This is not a coil. I'm not going to do a breast in this one. Okay, this is the coil. And this is the best coil, different from this one. This one, when there is a patient for positioning, you need to look to the breast from the side and from the head. Okay? And the other model here, you cannot, when you put the patient down. That's why it's not preferable. That's why, the companies are giving you free. Sometimes they give it to you free because they know that you will not ask for it. For proper positioning, do not tell the patient, lay down. Okay? Put her on the table and like guide her to the bar, to the center of the coil. Okay, check for any fold. You see there is a fold. And this will cause problem with the fat side. This is how you remove the fold. Teach the nurse, if the one positioning is a nurse, to put the hand and to pull the fold down. No need to ask the patient, raise your body up and then put it. Just pull it down. check the breast position, head, foot, and right, left. You see here, it looks perfect positioning, right? And the other side, it's not. When you look from the head, it's, you see it, it's coming straight, but when you look from the head, it's shifted to the left side. So that's why when you have open coil, it will be more accurate to have good position. Before you start the survey and then you ask for reposition. And nipples has to be hanging.
Sorry
Why
for
is
the
that?
interruption, doctor. You have 3 minutes left.
Sorry?
Sorry for the interruption. 3 minutes left. 3 minutes left.
3 minutes? Wow. I'm slow or the time is running fast. You see here, it's really serious. You didn't see the nipple. That's compressed. Contrast isn't flowing correctly, smoothly through the tissue, and that might cause false negative or false positive even. So it has to be this way. See here, also the same. It might mimic lesion. You might think it's lesion while it's compressed tissue. It might obscure retroareolar lesion. It might obscure the lesion. It will hinder the contrast inflow, making lesion evaluation inaccurate. The contrast did not flow in the lesion because it was compressed, not because it's not vascular, less vascular. And, doing so, okay, if there is large breast and you need to deal with it, you have two ways. The first one is to put a towel over the coil, and that will elevate the patient a little bit, okay? The second, cup. You know that in some machine they provide cup to lift the breast up a little bit. But be careful not to cause this problem. When you have it this way, it means the cup is pushing. It's not only elevating. And that will cause an homogeneous fat sac. Okay.
Thank you, Dr. Abdulhameed, for all the useful, interesting information. I appreciate all the information you mentioned earlier. All the questions will be discussed later on, as we mentioned earlier also. Thank you so much.
Just one slide, just the last one. You see here, just this one, with the implant. Usually we do the breast this way, isn't it? With the implant, it has to be down. We should put it as that position. Here, it will look as there is bulge at the axilla. It's not a bulge, it's the position. Just put the hand at the side. If there is bulge, it will appear. If it is not bulge, it will go back to the normal position. That's it. Thank you.